The Centers for Disease Control approved pediatric COVID vaccines earlier this month for children 5 to 11 years old. Well, lots of parents still have plenty of questions. Here to help answer a few of them is Dr. Elizabeth Mack, Pediatric Care Division Chief at MUSC. It's good to have you back.
Thank you so much, Layla.
And I certainly want to talk about pediatric vaccines, and we're going to do that in just a moment, but I want to address a few things that a lot of adults still have questions about for themselves, and that would be between the 3 shots. So we understand that between Pfizer and Moderna, 2 different shots, each one requiring 2 plus a booster, correct? What's the difference between first, second, and booster?
It's a good question. I think there's some confusion about that. So the truth is they're the same thing. So whether it's number 1, number 2, or number 3, it's the exact same drug. There's not a difference. You don't pull up out of a different vial for number 2 versus number 1 or number 3. So I think it's a good question.
Thank you so much for clarifying that, because I think if you go and someone says, oh, you're here for the booster, when you're really there for the second shot, not to fret.
Yes.
It's
same thing.
One and the same. They're all the same. All right. And then another question that a lot of people had is, well, if I started with Pfizer, can I get Moderna? Or if I started with Moderna, do I get the second shot in Pfizer? Is that okay?
Yeah, so the CDC has come out with some recommendations on that, and it's called mix and matching. And actually, there are some combinations of mix and matching that actually have really great results. So there are links on the CDC website specifically about that, but I would just check to be sure. The combination that you're considering is a good one, but Pfizer is the only one available for children right now. I know that they have been looking into the studies for boosting for all of the various vaccines that are on the U.S. market in particular. But yeah, I think they're actually looking into mix and match for all of them.
Oh, very
right
interesting.
Yeah.
Oh, that's really interesting. Okay, well, let's dive into children. So how are the infection rates amongst children these days?
Yeah, so it's a good question. Right now, what we're seeing, not surprisingly, is a surge of MUSC, or that multisystem inflammatory syndrome in children. That tends to follow a COVID surge by a month or 2. So the timing works out, and it is a response to a prior COVID infection that you may or may not have known about. Wow. So we are seeing a fair amount of that right now. COVID is a bit lower than we had been seeing, thankfully, but we still are ranking in the top 3 in terms of cumulative COVID cases in this country, cases in children per 100,000 children. So our rates are still higher than most of the country. And we are also anticipating a surge in the coming month or 2. So
because of the holidays, just people coming together?
That, and also the weather, and just looking at the trends from last year, we've sort of followed the same exact trend in terms of the time of year. So bracing for another surge, unfortunately.
Where are children mostly getting it from? From each other? From adults?
It's a good question. It's hard to actually pin down exactly, because most people are around multiple groups of people, but in general, it's often close contact, and it can be, with sports, or indoors where there are groups of people, such as schools, and particularly when kids are in mass or in really close contact.
Right. And for children getting the vaccine, a lot of parents still have concerns about this, and the CDC just approved having children between the ages of 5 and 11 to get a shot. And these shots, by the way, are not the same shots that are given to adults. Correct.
So it's a third of the dose. The Pfizer vaccine for children, that 5 to 11-year-old age group, is a 10 microgram dose, whereas for the 12 and up is a 30 microgram dose. And it actually comes in a different vial, even though it's the same exact drug, just so there won't be any confusion or errors. It comes in a different color vial, and it's prepared a bit differently, so as to have a visual cue that there's a difference.
That's good to know. Yeah. Because I was going to say, could it be a mistake that a child gets the adult version when they shouldn't? And what would happen if they did?
Honestly, that there were dose finding studies within the trials, and it just so happened that kids had less of the side effects with the lower dose. It's interesting, though, because if you're 11 years old and 364 days today, you'll get the 5 to 11 dose, and then if you turn 12 tomorrow, in 3 3 weeks, you're going to get the older dose. So it's a little quirky, but in general, most people did just fine. It's just a matter of the fever, the fatigue, the arm soreness, and that kind of thing were more common with the higher dose.
I see. Oh, okay.
Yeah.
And now they've just, or coming up on the time when those children that got the first dose can get their second dose.
Yes. So it was the end of the first week of November that we in South Carolina first administered those 5 to 11-year-old age group the very first vaccine. So here we are coming up on the 21 days later, vaccinating the 5 to 11-year-old age group for the first time with their second dose.
Right, okay. Anything else that parents are asking that they're concerned about?
Yeah, I mean, parents should be concerned with what they put in their children, and I'm always, glad to answer those questions because I think they're important questions to talk about. A lot of people are asking about, vaccine-associated myocarditis, and the answer, the heart inflammation, the answer to that is certainly, again, we want parents to be alert to and concerned about anything they put in their child's body, but the truth is that the risk of COVID-associated myocarditis and MUSC, or the multisystem inflammatory syndrome associated myocarditis, are far greater and more severe. So you're always weighing the risk and the benefits of everything, and thankfully the vaccine-associated myocarditis has been very infrequent, and it's also been much less severe.
Well, that's good to hear. And right now, as we stand here today, about half of South Carolinians have been vaccinated. So just still practice social distancing and all the good things to keep us safe.
Yeah, unfortunately, so we're sitting at about a half of South Carolinians fully vaccinated, about only a third of the 12 to 19-year-olds being fully vaccinated, and only about 5% of the 5 to 11-year-olds having gotten their first dose. Okay. So particularly the children are at higher risk, and like you said, it's all the things we know and love that we've been talking about now for 2 years.
Be careful. Don't, do silly things.
Exactly.
Dr. Mack, I want to thank you so much for coming on with us.
Thank you.
Wonderful information as always. We're back after this.